Didn't think we could sit there.
You can probably just move that way. Yeah. That'd be fine.
I guess these will come off first.
I'm here for the day. Just go ahead, move it that way. Keep going, keep going.
That's fine. We want it behind us.
Oh, you okay?
Hello everyone, I'm Michael Keeler, the CEO of Veterans Healthcare Needs. Today, me and my colleagues are here to inform you a little bit about the VA health scandal. I'm here today with my optimistic specialist, Mr. Stephen Walters, and my patient protocol manager, Ms. Angela Dennis. Today I'll be speaking to you a little bit about the negative effects, then I'll have Ms. Dennis come in here and give how we plan to fix those negative effects, and then I'll bring in Mr. Walters to give the positive effect of this scandal. Ever since this problem became known in 2013, it's been known to the public that this is a big problem. I'll speak to you a little bit today about the patient care wait times, the inadequate information about veterans, and the poor patient management. The Veterans Administration healthcare scandal deals with problems in the U.S. healthcare delivery system as a whole. The scandal is a result of the government's monopoly on the provision of the healthcare. For this reason, sick veterans have improper scheduling and have no choice to avoid the bureaucracy that the healthcare system has given. The U.S. veterans suffer from poor management and deadly healthcare delays. Just recently, it is well known that the delays for this scandal are the death-causing factors of the scandal. As you can see in the article that should have been handed out prior to this conference, we have VA veterans that are dying just 30 minutes away from the hospital. This is a result due to the rules set forth in the VA saying that they can't dispatch an ambulance for a certain amount of time. This is a problem because we shouldn't have veterans dying because of wait times. They should be seen on their scheduled appointment times and have an ambulance dispatched immediately, knowing a known emergency. Veterans and their family members report about delays in the healthcare VA facilities on CNN.com. According to CNN, one of these notes by a man named with the last name El-Haj states that clerks in the VA are forced to schedule them months in advance, when really veterans need appointments immediately. Deadly healthcare delays are getting worse all over the country. For this reason, they are the main reason that veterans and family members are dying because of the scandal. According to MinutemenNews.com, an editor by the last name Assenheim noted that the Phoenix VA hospital was the center of the scandal. Many doctors and stakeholders were accused by falsifying medical records and inadequate information of veterans with the aim to hidden healthcare delays. American veterans who defended the country became victims of the bureaucratic system, and the research assets that they were mistreated very poorly. Veterans in many U.S. hospitals and clinics have turned this into a massive scandal. Poor patient case management leads to poor quality of veterans' healthcare and treatment. Veterans case managers should provide better information to their patients, what treatment to implement, how to avoid the delays, and prevent preliminary deaths among veterans. Not too long ago, the president was accused not to fire these healthcare officials who are responsible for the improper treatment and delays in those hospitals. Poor patient case management is the result for tarnished reputation of the agency and was founded to help American veterans. At this time, we'll bring in my patient manager, Ms. Angela Dennis, to give you a little bit how we plan to fix this problem.
Good morning, everyone. My name is Tangela Dennis. I am the patient protocol manager. I want to talk to you a little bit about a few ways we can fix these issues that we have going on with the VA. A couple of things that we can do as far as the veterans' health care needs are concerned. We need to try to get them in to be seen quicker. We're going to cut down on the amount of time between the doctors, the scheduled doctor visits. The USA Today.com posted an article on May 22nd stating that Obama was not going to tolerate misconduct at the VA. And as far as poor patient case management is concerned, Economist.com reported May 31st that there will be no quick fixes to the issues that are going on, and that Mr. Eric Shinseki did a poor job of running something that was already dysfunctional, and Congress just had to replace him. That's it. The patient's needs to keep their scheduled appointments. The VA can have better record keeping system, and this can be done by implementing. Well, it is being done by they're implementing new procedures and protocols. They have something called an electronic waitlist system, which will accurately track appointment requests and doctor's visits. As far as healthcare delays are concerned, according to an article published on the WashingtonPost.com website on July 1st, the VA has terminated this goal of seeing patients within 14 days of appointment request. They're trying to get them in sooner than that, 7 to 10 days. And this can be done. Obviously hiring more providers and better personnel is one solution for helping the veterans that defend our country. We build more facilities, improve on the older ones are some solutions that can help the situation out. And as far as inadequate information on veterans, things such as records aren't being kept in order and false information. These issues can be resolved by personnel paying closer attention, to details when taking patients' information, and by not making typos, because that's basically kind of what the majority of those mistakes are. And in one VA worker's opinion, this problem has been it's been this way for a lot of years now, and it's really not a scandal as far as that's her personal. And it's just a thing where congressional restraints are hindering things to alleviate the existing problems. So now I'd like to bring in our optimistic specialist, Mr. Michael Walters, to answer further questions.
One thing's for sure, that seems like a lot of just negative stuff to talk about, and like they said, I'm the optimistic specialist in this scenario. For every bad, there's a good, and that's pretty much what we're going to talk about right here, right now. One of the bonuses of the VA scandal right now is that Congress is getting its act together and doing a lot more work than it's ever done before. According to DeseretNews.com on June 16, 2014, Congress has been more inefficient than it ever has been in the past history. But it's a welcome change to see them working together and getting bills passed faster, specifically in this case with the VA scandal. Another great side about them passing bills, is that the political parties are working together to fix this issue. Democrats and Republicans are heading towards the same goal. They know that veterans are very important. It's not more about, the Democratic Party fixed this issue. It's just, we need to get it fixed for the better for our society as a whole. One of the bonuses of that, it also strengthens other political parties that aren't Democrat and Republican. An example is Spectator.org on May 22nd published an article stating that this is a very distressing situation, and that other parties such as the liberals, the American left, are more confident than ever because there's with social media and education under everybody's control towards this issue. It helps a lot of people get a better understanding of where they want it to go and who's helping to fix the issue, and it can help change a lot of minds and strengthen other parties that would have never been strengthened before. Another positive outlook of this is the transparency and options of the situation. BearitVNews.com published an article on June 10th providing information about the Veterans Choice Act, which is a bill about choice, transparency, and change. Pretty much what it would state is that it allows veterans to seek care with private doctors instead of having to wait for the VA specific care. A few of the veterans and people right now know that TRICARE is pretty much a similar system. Sometimes you can't be seen by a certain doctor, some are in their field. It will kind of work the same way, but hopefully they'll have a lot more options of where you can go to get this issue resolved. One of the sad parts about this scandal, but it's still good, is that it's overshadowing the good that is being done at the VA. It's not just like the service is poor all the time and they don't do good work. They still do things that are actually very helpful. According to MontgomeryAdvisor.com on May 26, 2014, that in 2013, more than 40,000 resident physicians and 21,000 medical students completed training at VA facilities. That's quite a hefty number, specifically if they're not doing good work, which obviously is not the case. And it's also stated on that site that VA outperformed Medicare in their fee-for-service care on all 11 quality measures. That means that, they're doing good work. You can't acknowledge the facts on that, and sadly the VA scandal is just one negative aspect that has been blown to cover up all the good they are doing. Another thing is that this brings worldwide attention to something that is real and in our face with a bunch of facts and evidence. An article posted on June 5th, 2014 on the Atlantic.com's website stated that there clearly is a scandal here, and it's not a debated one with ideas and opinions such as the IRS one or Vagancy. There's clear facts that you can find anywhere and talk to anybody about. And pretty much today, with us talking about the VA scandal, that's what we wanted to really cover, was just, what it is, some of the negative effects, some of our solutions, and it's just not all bad. There is some good. And pretty much me and my colleagues right here would like to open up the floor to some Q&A if you have any questions. Yes, ma'am.
Does this issue happen at all VA facilities throughout the country, or is this specific to a particular state?
At this moment, it's really big here locally at this moment, but it is happening in other VA facilities as well. But as I said, in Fayetteville, it's real big right now. Yes, sir.
How exactly is misconduct related to prolonged wait times at VA hospitals? We call it a scandal, and a lot of VA workers say that it's not a scandal. You said we might hire more doctors. You said we might refer out to other hospitals. But why are they calling it a scandal and saying that misconduct is related to these prolonged wait times?
At this moment, misconduct is related because a lot of it's misconduct. A lot of our doctors are poorly trained and they're not where we want them to be. So the only way to really solve that is to hire new officials to take their place and let them go.
And one example of that's with Shinseki. He came into a dysfunctional organization to begin with, but he wasn't properly trained to handle the situation.
Yeah, they turn it around into
better.
a positive situation.
And that's one example of why.
Yes, sir.
What do you have to add or dispute against the allegation that it's pretty much what's going right now, the claim of, whatever's going on is really just a cover up for the overall movement or intention of the VA, which is to take money from veterans and deter them from becoming dependent on the VA benefits?
At this, we're not really aimed to take their money from them. We're aimed at more offer our help and get them to have all the benefits they need to survive in life. So, yes, sir.
What is the doctor to patient ratio in comparison to the civilian sector?
At this time, that's something we didn't research. We could go definitely research, contact the headquarters and try to get that information. But in our studies.
I would think that would be an important factor in the long wait times.
Well, actually, the doctor-patient ratio is like, every one doctor is like, they have like 1,500 patients that are assigned to them at one time.
Which is why hiring more would help the wait times.
So here locally, when, for instance, with TRICARE moved all the patients back on post, wouldn't that create more of a problem for them, like taking all your patients back? when you already have an overload of veterans and people who are active duty and all this, we already have that, and we're just adding more, you know, just creating the problem. So how exactly would you cut down on that, other than referring out and adding extra doctors? If you're already taking away the doctors that don't know anything and putting in new ones, are you going to be adding?
We will be adding to the doctors, but we want to get rid of the ones that don't know what they're doing to replace them first. So that way we have highly trained doctors that know what they're doing, and if we need to hire more doctors, we will.
So two related questions. Tangela, you stated that if they need appointments immediately, you know, we're trying to cut down from the 14 days to the 7-day goal. If they need appointments immediately, why don't they just consider this an emergency? Why can people not wait for 14 days for an appointment? If they can't wait that long, why are they not just using the emergency services at the VA hospital? Are these backlogged? Are they extremely long wait times? And then on top of that, is anyone in the VA looking into the issue of the fact that veterans are taking advantage of the system as well, which is just making it even more difficult to solve the VA scandal?
At this time, we are looking at the bad side with the veterans taking advantage, but due to the emergency, some rules set forth in the VA, we're trying to get those overturned so that we can declare it as an emergency and get, like as I stated, ambulance dispatched immediately if they need it, or any appointments that they need for an emergency care.
Can I follow that? So are there actual situations in which someone would go to the emergency room and then be turned away from emergent services?
At the moment, yes, that they are being turned away, which is why we're trying to get them overturned. The rules stated in the VA to our headquarters, but it's in, as he stated, it is in Congress right now trying to be overturned. So we can't do nothing until it's overturned.
And that's what,
She has one. We got it.
that's what.
Yeah.
Okay, in looking at balance, because it was mentioned about training, is there balance looked at in the emphasis of outsourcing the training, getting trained outside of the VA to take some of the load off, and then gearing more toward focusing on service versus training?
The one study I did when I researched it was that was specifically just VA facility trainings. That 41,000 was just VA ran, not outsourced or anything like that. When I was looking up the information, they stated that they want them trained the way they train them, and in order for them to be that way, like an outsider coming in would be almost the same problem.
Well, wouldn't it make sense to take a load off of the VA facility to have the ones that are overhead of training departments to train, to do their training outside, so that they can have some other company or some outsource take that load off of the hospital itself? That way they can focus toward services.
It would, but and another thing when I was studying about that is like liability concerns. Is when you send somebody out from a specifically trained facility and they go somewhere else, if they do it wrong, you just
Of course.
you're gonna, and they're trying to avoid more pressing
But they can
issues.
look at maybe perhaps certification through the VA, which would.
What we're going to look for is more, what knowledge they have, what service they have, and obviously the skills they have for the job. So.
Thank you. Great job.
My appointment's at the VA at 12 o'clock. 3 hours later, they call me into the office and tell me we need to reschedule. I go to the emergency room. I go to the emergency room, sit there for 4 hours, and they tell me make an appointment with your primary care. I call my primary care. My appointment is 3 months out.
We have a time frame for our meeting. Is there a time frame?
Oh, you well, just what you did, we'll let you know. Great job, great job.
Well, thank you, Chuck.
I know.
I knew for the Q&A, I was like, oh.
I was really listening because my husband's battling with that right now.
I was like, I knew for the Q&A we'd be in trouble because every single person here probably has a VA
No,
problem.
but you had an answer and a comeback for every single one. The one that made sense. Excellent job, CEO.
Y'all want to talk?
Can we keep?
If you want. I mean, I've read it.
Why did somebody already drag that